Good morning, Lagos. Good morning, Nigeria. Welcome to this webinar, Surviving the Times, the Future of Healthcare in Nigeria Beyond COVID-19. My name is Dr. Tunde Ayeye. I'm the Group Managing Director of IFS Group, International Facility Services Group. And I will be walking through with my colleague here, moderating this event this morning. So I'll use to allow me to introduce myself and our partner company that we're doing.
Good morning, everyone. It is a pleasure to be here today, and the discussions today are very germane in moving the country forward post-COVID. I'm very honored and humbled to be talking to a set of distinguished people to help us digest and dissect this topic today. My name is Dr. Olamide Okolaja, and I'm the Director of Advocacy and Communications at the PharmAccess Foundation here in Nigeria. A lot of people have been wondering what is the link between PharmAccess and IFS. The link is healthcare, and how we can try to merge that to see how, as a country, we can move forward in implementing and providing quality healthcare services to all of Nigerians.
I'd like to welcome His Excellency, the Executive Governor of Lagos State, who will share his comments and thoughts with us. We practically had to beg and drag him, and we are he graciously agreed to spend some time with us, opening this conference for us. Please make welcome with me His Excellency. He loves to be called Mr. Governor Babajide Sanwo-Olu for his opening comments. Mr. Governor, sir.
Well, thank you very much, Dr. Ayeye, and thank you very much, my crew from PharmAccess, who have been saying a whole lot more in the last 2 months. Good morning, especially to my elder brother, a leader and a friend who were still on the phone less than 24 hours ago, the Honorable Minister for Works and Housing, Nigeria, in his own right too, an excellency, Mr. Babatunde Raji Fashola, who I'm sure we're all excited that he can also find time to be here this morning. I want to thank IFS and PharmAccess for putting this together as well. Toyin, good morning. Mrs. Indili, good morning. Prof, there's nothing for us to be saying good morning. We just ask you how many hours did we cut? Because we're still on till very late last night. So indeed, it's an honor to be here this morning and to share a few thoughts, you know. And it's also not very correct when Dr. Ayeye said they had to beg and drag. You don't beg and drag a man to come and do his job. When you sign up for a job, it's really just for people to call you and get up and just do the job. So it was just a balancing thing. And the reason is not far-fetched. As we're speaking here now, there's also a governors forum meeting that is going on. So I had to get my deputy to sit into that meeting, and about 4 governors have called this morning already. And I said to them, well, I've given commitments to this meeting and I have to do it. And it's also a very wet Thursday morning. We also, as a government, have a few commissioning to do. Or like PR officially said at that time, we have a few handover to do. So we have a few projects we're also handing over to citizens this morning. So those are the things that are putting the pressure, you know, on the timing. But like I said, it's indeed an honor to be here this morning. You know, and I look at the topic, the future of healthcare in Nigeria, facilities, technology, and financing. There cannot be a better time for all of us to begin to look at engagement like this. How well are we before COVID, during COVID, more importantly, after COVID? Like the saying says, leadership is really not born about what problems you have or what are the issues you contend with, especially in a pandemic like this. But real leadership is what are the lessons you learn and what are the things you take away post, the pandemic or post the crisis period that we have. So all of us are beginning to look at, economy, and we're looking at, what are the things that went wrong, but more importantly, what are the things we need to be doing going forward. For us as a state, it's no longer news how we got to where we are. There's no better person that can tell the story than Mr. Babatunde Raji Fashola himself when he was governor, and we had the Ebola case that ravaged, Lagos and the entire African part of the sub-Saharan Africa at that time. And very quickly, the learning from that was that Lagos was able to build, with the likes of Professor Abaomi, over the last 5 years, build capacity and build competence, around a biosecurity lab, and pretty much just expecting that when will another pandemic or a crisis happen. And in December last year, we heard about the coronavirus, and today it has changed, the entire world space. So what are we? What are the lessons and what are the things we're doing, going forward? I see a few thoughts around the few things that Dr. Aye will be asking me, that maybe there's been some increase, in mortality around our 0 to 5 ages of children. And so if people have been dying, from some of these things, more importantly, even during COVID period, there's a likelihood from some report from John Hopkins, like you said, that we've even lost more people. So my response to that really is that part of the things that we realize is that we cannot stop all of the other things we're doing on our secondary health facility and our tertiary health facility and just, face only COVID-19. It's a national, it's a global issue, but we still have illnesses, we have sicknesses that people must treat on a daily basis. So around our 27, 28 secondary health facilities that we have, we ensure that we do not drop our eyes on it, that we do not lose, our strategic focus in that area. Just to say that we're actually commissioning 2 MCCs next week or week after in Epe and in Badagry. So those are some of the things where we ensure that we are not lacking behind. We continue to build some of those infrastructure. And like I said, my brother and my friend started the conversation around MCC couple of years ago. So what we've done, or the things we've done in the last 2 to 3 months, was that I ensure that because of how the conversations around movement and no movement and the staffing was that to give access to people that are vulnerable in our system. And that speaks to the mortality of 0 to 5, which we're talking about. We gave access to people that are more vulnerable in our system, and we gave them free medical access. So people that were pregnant, that had deliveries throughout the month of March, April, and May, that were in all government institutions, they've had their deliveries free of charge, be it normal delivery, be it cesarean, C-sex, we have taken up the bill because we realize that people have been out of work, right? A 30,000 naira or a 35,000 naira will make an husband, a potential father, run away from the mother, and then the woman will just be left. So we've kept faith with that. We've ensured that simple tests in all of our hospitals are done free of charge. We ensure that consultations that either to, ask them to pay for card, all of those were borne, by us in the last 2-3 months, and we've ensured that we do not, fall short on our delivery and the secondary health facility, even whilst dealing with COVID. And so it's been well publicized. All of our primary secondary health facilities, they've been running these things free of charge. Accident and emergency too, you don't need to collect money, just go treat the patient, and so that we can save life and we can continue to provide service to all of our citizens. So that has started. It's not something that I'm saying today. We started it over 60 days ago, and it's something you can. So in terms of that mortality, I do not think that we have lost any child, more because of COVID or because we've lost, we've removed our eyes on the ball and things that are around that. But what we have also done is to wrap up capacity in terms of facilities, around the COVID issues. We know there's a national policy around anybody that you test. Once they are positive, you need to isolate them and keep them under, your watch. So that is some of the things that we've done. And to date, we have about 7 or 8 of those isolation centers, purpose-built, purpose put together for proper isolation. So we've wrapped up facilities, both in hard physical facilities and some that are makeshift tents and all of that. But more importantly, we've also had engagement with a lot of hospitality places, hotels that we have converted to quarantine facilities, to holding bay. The 2-3 days while we're not sure about your positivity or negativity, we do not want to lose you. So we'll keep you quarantined, we'll hold you down in some of those facilities. So, and we have about 16 of them. We refuse to tell you that a facility is in number 3, so in Iberjuleki, or number 4 in Ikeja, because of fear of stigmatization of those facilities post-COVID. So we've kept those facilities under wrap. We know where those facilities are, and we'll be using them. A lot of our health practitioners that are on the front line, we also ensure that we keep them safe from their families. Some of them live in these hotels and they go to work so that their turnaround time is faster, is quicker. And these are some of the places where we've seen increased capacity from our health workers in terms of their ability to respond to issues and in terms of their commitment to this very difficult time. There's also conversation around, given what we know or what we see, where is our where is our health insurance scheme? Where is it, before now, and where should it be, going forward, And yes, I want to thank PharmAccess and all of you. Last year, you supported the state government to set up Lashmi, and we thought that by now, Lashmi will be up there, having over 1 million or so, or 2 million, registered under the health insurance scheme. That hasn't happened. There are conversations around Mrs. Ndidi, whose fault is and whose fault is not, why we don't have those numbers. But what have we done as a government so that we're not just complaining? We have said that the staff, our civil servants that are under our beats, let us use ourselves as a test case. So all of our 180,200 health workers, I have taken it upon for us to pay and to use them as a springboard to stimulate, investment in our health insurance scheme. So we've used them and we've paid, for them. And I'm aware that over the last 6 months or so, we've been doing enumeration to begin to determine, the real vulnerable and the poorest of the poor that will require government intervention and government support, so that they will be able to come up and have access to some of these health insurance scheme. We have not done a decent job of that, and I'm speaking publicly, and that's why, as a leader, I had to take the very hard decision and ask the general manager of the health insurance scheme to resign about 2 months ago. So I didn't know that there will be a meeting like this that was going to ask me, what have we done with the health insurance scheme? I've had to ask the lady to go because I have not gotten the level of commitment, and I've not seen the level of interventions that I expect that I'll be seeing today. And so without you guys telling me that we've not done an excellent job, we've taken the decisions on ourselves and we've put somebody else there. So we believe that with Dr. Zamba, sitting there in an active capacity, we will see a lot more, attrition. We'll see a lot more turnaround in that space. So we're just, proactively taking our own destiny into our own hands, and I will say to you that I know what your concerns are, that we need to increase those numbers. That's why we're committed to it. And we believe in our leadership that in the next 6 months, we will see better numbers coming out from that agency, and we can wrap up, the kind of expectations that all of us are expecting, in that space. And I think the third point that I'll make will be around the concerns around, yes, the state government have had to reduce its budget in strict reality of where we see ourselves. I'm sure a lot of my colleague governors are looking at the numbers. We are a lot more proactive. I think federal government is looking at their own budgets today. So a month ago, we have been very, very hard on ourselves and said, before we begin to run away, let's slow down. Let's see what the indices are. And we've done all sort of scenarios building, and we know that this oil thing, $20, $22 would be a fair thing. Federal government is hovering between $25 and $20 now. There's a minister in the House. They can speak to what exactly they will be doing. But for us, I have a 1.1 trillion budget. That's the biggest budget Lagos said I've had to take to the House of Assembly, and we're committed to pushing that budget. But the reality of COVID has shown to us that we need to cut some of the lines that we see will not fall into the expectations of this year. We've seen our IGR, which is a major thrust at delivering that budget. We've seen a 2 months rundown in the numbers coming down because of COVID. People are not at work. We cannot begin to enforce some of the laws around, payees and all of that. So we needed to just say to ourselves that we don't think that we will be able to achieve those numbers. And for us in Lagos, it's better for us to have a budget that you can score 95% than have a budget that you are scoring 55%. I think those are some of the learning that we have as a government, and we said that it's better we stay around budget that we can fully implement. So I want to assure you that some of the concerns that maybe that budget has affected health, for example. In fact, health is the only one that have seen a growth in their budgets as against other sectors that have seen a dip, in their own budget. Health is the only one, and is one of the reasons why we pulled back that budget and we've looked at it to say that where do we need to begin to put infrastructure, where do we need to begin to put financing, into the years and the months ahead. I'm sure the jury is out about how we have lacked infrastructure as a country, and more importantly, as a state, in health, and in health-related facilities. But I think, I'll just round up by saying that technology, in our view, must be a strong driver even in that space going forward. Technology for us has even shown, as we speak today, that it can be a strong enabler. So all your three topics around facility, where we think infrastructure, we need to continue to grow those infrastructure. We're not there yet. Financing, we need to continue to push and ensure that. And part of the commitment I gave was that I will wrap up my year-on-year budget for health and get to about 20% in the next 4 or 5 years or so. I think we're doing about 14%. But it's not just to have the budget, it's to ensure that they spend that budget, they have a capital expenditure that actually utilizes that budget. And Commissioner is here. He knows that I've been fighting with him since January to ensure that we spend on those budget lines. And I'm dare say that we have a few that we've ticked, we've approved, and we will see developments going there. And so the final things around technology. So we've also creatively engaged very smart young Nigerians that can also help us scale up, competencies and capabilities in that space. So what are we doing? Post-COVID, we will need to use a lot more telemedicine as part of the ways to go. How can we access all of the human capital that is bound, available everywhere in the world, not only the country? How can we bring them closer, to be able to give our people access to what they require? Then we're also looking at our emergency response capability. How can we use technology to be a driver for that? So these are things that we've actually signed off to, and we've given strong IT companies partnership for them to help us develop those capabilities. And in the weeks and months ahead, and I'm sure once those designs are out, I think one of them is supposed to even be out in another 2 weeks, you will see us implementing, using technology as a driver in ensuring that we're able to bring health issues closer, faster to our people, And at the end of the day, we cannot but work with the private sector. And what do I mean by the private sector? The very many hospitals that are not under ambience of the 28 secondary and about 330 primary health institutions we know we still have about 1,000 out there, about 1,200. All of us need to come together, in some space and be able to strengthen, access for our people. And I know that the final thing you want me to talk about is the commitment around, health insurance, the health insurance scheme. And I know you've said something around, that why don't I push all of those budgets? Why don't I just push it around health? So around pay for the premium for my vulnerable and for my citizens, and let the supply side, which are the private sector, completely take it over. I'm not sure there's anywhere in the world where anybody has done that completely. And I think it's a very strong, radical shift. I'm not going to put my head and put my political collateral on the table and do that, because that they'll cut off my neck. And more importantly, even learning from a public health issue like COVID-19, which is a public health challenge. I don't know how much, if we don't have some capability, how much of a private hospital we're going to ask to come at this point in time and say that open your hospital, let it be a COVID hospital, open this, we must let you take only COVID patients. So there's some balancing that must come to that, and government continuously must have a responsibility to its citizens. And that's why I don't think that I'm going to subscribe, that I'm going to write a check and pass on that to everybody. I'm the only one speaking. I don't know how long I've spoken for, but these are just my initial thoughts. And like I said, the topics you've pushed out there, facilities, technology and financing, it's very, very germane. And I think it's learning points even for all of us going forward. We need to be able to, we're doing a meeting yesterday. We had a meeting yesterday where we're balancing COVID with the economy, and we realize that this economy must continue to work well. If not, we'll begin to see 30, 40%, job losses in the weeks, and months ahead. So as your governor, these are some of our responsibilities to ensure that we balance all of these things up very quickly, and we bring different stakeholders, and they understand, transparently, communication is important to ensure that they know what we're doing and what are our plans, going forward. I want to thank the organizers. I don't know if there's still a few things that you want to ask me before I take my leave. Thank you very much.
Thank you very much, Mr. Governor. I mean, working closely with Mr. Governor is not one that is very appreciative of unnecessary accolades, but I must say that, he has demonstrated the leadership that we require in this time. And, we just want to say in very few words that we appreciate you not just as the governor, but as the incident commander, making sure that people are safe in Lagos and indeed across Nigeria. Thank you very much for those words of wisdom. And we hope that you'll be able to stay with us for as long as you can, because we have several questions we want to ask you. But if you have other issues that you need to attend to, we'll also appreciate the little time that you have committed to us. So once again, thank you very much, I think, for the opportunity to be working with you closely on several other fronts. So moving forward, we would like to invite His Excellency, the Minister for Works and Housing, Mr. Batunde Raji Fashola, SAN, to please give us the keynote address for surviving the times of future of healthcare in Nigeria. Thank you very much, sir.
Okay, you need to unmute your mic, sir.
while His Excellency were walking through just that speech, thank you very much, Mr. Governor, for such great thought. It's obvious you read through every line of the document I was sent to you, like every point. And some of the interesting things that you raised is, I'm sure we'll have opportunity to continue to engage. But coincidentally, we have the president of CAMPAD also on the call. CAMPAD, he leads the Canadian Nigerian Association of Doctors in Diaspora. And something close to that radical shift is what the Canadian system has. So I don't know if Professor Yemi, you want to maybe you want to type or just share your thoughts, but I think we'll watch for His Excellency to be ready. So you can just say one or two things. How does it play out where you are at in that regard between the public and private sector? And I'm sure we'll have opportunity for further engagement with Mr. Governor to support all the great work that he's doing. And also to mention, sir, the issue around providing free health. To be fair, the amount of people that will have died that policy has saved is enormous. I spoke with someone yesterday who is working in one of the general hospitals who was on call overnight. She did 8 cesarean sections for unbooked patients, which means those are people that were never booked. 3 of them had eclampsia. I mean, the doctors in the house will understand what I'm saying. Those 8 women would have died, but for that policy. So the learning point is these things that have been done right, going forward, we'll learn how to institutionalize them. I don't know whether His Excellency is ready. Oh, he's still coming.
His mic is still not on mute.
Yeah, I think there's some issue with
So Professor Yemi, can you just
you should listen to Professor Yemi.
Good morning, His Excellency. Thank you very much for your presentation and your effort in fighting COVID-19 in Lagos State. Thank you for seeing Lagos as leading in this fight. We really appreciate all the work that you've done. And thank you for having me. Good morning, panelists. Over here, the pandemic hit everybody surprisingly, just like it hit us in Nigeria. And the government has taken a few steps, which has been draconian in Canadian standard. I must say that I'm not sure whether we have a different strain of disease, but compared to what's happening in the south of our border in the US, we do not have much of serious problems. But one of the things that's common is that the infection is serious in areas of areas that are densely populated. So major cities are hit harder than smaller communities. We have a public health system here. So access to healthcare ideally should not be a problem. But we know that because of the overwhelming situation of the pandemic, we have challenges with the resources available. The capacity of the healthcare system is not robust enough to deal with the pandemic in a timely manner. That being said, you know, I just want to put a comparative there. I live in a province that the total population is 1.2 million. Nigeria's population is 200 million estimated. We have done about the same number of testing for cases of suspected cases of COVID-19. So we're not doing enough testing as much as we ought to do in Nigeria, and we accept that we're not doing enough in Canada as well. One of the challenges that I am looking at now is the burden of disease based on the number of tests that we've done in Nigeria. we currently have about 75% of cases that are still active, compared to my province of 1.2 million, where we have 12% of cases that are active. So I'm not too certain why we have a lot of patients still actively positive. They may not be severely sick, but at least they are carrying the disease and a potential risk out there. So one of the things that would be nice to look at is what's going on in that area and see how we can improve a recovery rate. Management has been a challenge across the board here. The basic, one of the areas that we've been successful is having people stay home if they suspect to have the symptoms, and if they have mild disease that have been confirmed. They're able to manage themselves at home with self-isolation, and only severe cases are admitted in the hospital. I must say that the government has been very, very effective in supporting all those who have been economically hit by this pandemic. There's been policies in place to at least guarantee a certain level of income for people who are within a income level, so as to keep body and soul together and manage their affairs. In terms of having access to day-to-day needs, food, drugs, and essential items that we all need at home, the system.
Hold that thought. Thank you very much. I think His Excellency Babatunde Raji Fashola SAN is ready for us now. Yes? Please, can you? It's not yet ready for us. Okay, thank you, Professor.
I am ready for you if you can hear me.
Thank you very much, sir. I guess these are the new facilities we need to deal with. So Your Excellency, Mr. Babatunde Raji Fashola, sir, our big senior brother, for all of us on this stage, including Mr. Governor, please, the Lagos and Nigeria is waiting to hear from you now, sir.
All right, good morning, and let me thank everybody, IFS, Farmhouse, and especially our governor for this further step in bringing together the human faculty that we have to discuss a topic as important as this. I must join all of you in commending the governor for the admirable leadership that he has shown. As a citizen now, I feel safe that he's in charge of Lagos. And I also want to acknowledge the work that his commissioner, Professor Abayomi, and all the other frontline workers are doing. That said, let me thank Dr. Ayeye, who has spared no effort at all to ensure that I participate here, and it's a pleasure for me to do so. I think that the place to start is to go back to what we did in May 2018. I mean, these were some of the discussions we had, and to say, perhaps by way of recap, what did we do 2 years ago in terms of facilities, in terms of maintenance? I think it is right to report back to the faculty the steps that I have taken since we last met. One of the things I believe we discussed in 2018 was that we should stop seeing maintenance and facility management as a culture. It's a business. It is an economy. And if we do not act consciously to promote that business and that culture, that economy, then we will see a lot of people trained with all sorts of skills: plumbing, welding, electrical, heating, ventilation, and cooling, go to take other businesses such as riding bicycles or tricycles, where there was no basis at all for skill acquisition, but they get on because it brings money to the table. I think it's important to then share with you what I have done since then. which was to present a maintenance program, a national maintenance program to the Federal Executive Council in January of 2019. And this was based on an assessment of major federal government facilities, such as the Federal Government College in FCT, the Kuje Correctional Facility in the FCT, the National Hospital in the FCT, the Federal High Court in the FCT, and Federal Secretariat in Abuja and some other parts of the world. We use this as examples of public buildings whose operational capacities could be improved, not only by repairs and maintenance, but also institutionalized facility management. And I will come back to the health part of it, because one of the facilities involved, of course, was the National Hospital as a model to then extend around all the federal medical centers across the country. The Kuje Prison Correctional Facility as a model to then expand around all the federal correctional centers in the country. The Federal Government College in the FCT as a model to then extend around all the federal government colleges across the country. Now, what was interesting was that the cost of maintenance came to under 2% of the asset values. And we also saw that these 9 assets that we sampled as a basis for expansion will cost about 40 billion naira should we have to replace them at that time. And it was going to cost less than 2% of that amount to keep it in good repair and order. So it made eminent economic sense to pursue this. And for those buildings, just 9 buildings, 9 facilities, what we saw was that we would need 448 people in employment to repair, to maintain, and to operate. And the federal government then approved that this become a national model for maintenance of facilities. And I think it is good to also speak to what some of these things involve. We saw in one of the court building, for example, had 68 air conditioners, 57 were functional, 11 were not functional, so you were either had to repair or replace. So that was somebody's job. The Federal Government College, 45 air conditioners, 26 were functioning, 16 were not functioning. So that was somebody's job. For us, it was important, therefore, to connect unemployed, skilled people. We had quite a number of them across the country with where the problems were. We had failures, we had light fixtures that were not working, electrical, and so on and so forth. And so during the process, we undertook the maintenance and repairs of 24 federal secretariats across Nigeria. That employed about 1,000 plus people. But I think it is important to also share with the faculty some of the spin-off effects of facility management based on this experience that is just evolving. We had to replace 1,774 doors. We had to install 82,713 square meters of aluminum roofing sheet, 16,614 drums of paint, and 48,491 square meters of wall and floor tiles. So the spin-off for other small, medium-sized businesses that supplied and manufactured all these was significant in terms of building what we discussed then as a necessity for a maintenance economy. I think it is important to wrap up this part by saying that since then, we have now got the head of the Federal Civil Service to approve the setting up of the maintenance department in every ministry of government. And we are now working towards getting Mr. President to approve an executive order that mandates all ministries, departments, and agencies of government to make maintenance a compulsory part of their annual procurement. And this will do many things. for public access in terms of lifetime expectancy, design life expectancy, and also create work for some of our most vulnerable people. The other point I wish to share, and this is important, is that compared to the assets that government owns in relation to the assets that are in the hands of the private sector, government assets are a very small part of the role that developing that maintenance practice and economy will have to play. No matter what government does, it will not be as impactful until the private sector, our buildings, our offices, and so on and so forth, become part of this larger maintenance economy. Now, just to dimension that, I recall then that I looked at the data of schools in Lagos, and with about 8,274 schools in Lagos, the state government owned only 1,669 schools, representing roughly about 20%. So 80% of the schools are in private hands. And so they are leaking roofs, leaking pipes, broken windows, broken doors in many of those schools. It will be the responsibility of the private owner of this asset to actually develop its own maintenance program. And this is true of the health facilities in Lagos State, because I had those numbers. And I recall then that Lagos State government owned one tertiary facility last week. There were 26 secondary facilities then, including some of the MCCs that the governor was talking about. And so 2 more are coming, as he told us, in Badagry and in Ekpe. This will add that number to 28. And there were 245 primary healthcare facilities at the time in Lagos. And if you add that up, compared to the 1,000 plus health facilities in Lagos, the government only owned 27%, less than 30%. So again, the burden of responsibility is so skewed on the side of private sector to also own this. Now, as far as maintenance and health care facilities, my intervention in specific focus to what we're talking about is that the first level area of attention must be the primary healthcare facilities, because that is where the bulk of the people in the state, in the country, and in many other jurisdictions first encounter the health system. And this is a place where antenatal care should take place if it works. This is a place where non-complicated childbirth should take place if it works. And this is a place where basic immunization of infants should also take place if it works. So I think, and basic surgery for minor cuts done under local anesthesia should take place in those primary healthcare centers. That is where I think that we should focus all our attention. In terms of facility management, I would recommend that for those facilities, management should focus on supply of water, supply of power, janitorial service, and the fundamentals of waste disposal and waste management, especially medical waste. And the necessity for that focus is even stronger now, as people are using disposable items to either cover or protect themselves. And what is the regulatory framework now with which we will collect that waste in a safe manner and dispose it in an efficient manner? I believe that Lagos State started something with regard to e-waste at that time, medical waste disposal at that time, and I think there can be no time more auspicious now to bring that back on as a model for us to follow. At the secondary and tertiary levels, what I would like us to focus on, I would recommend that we should focus on, is the training of young men and women in how to operate and to maintain or repair diagnostic equipment. And that, I believe, is in the field of biomedical engineering. The capacity to train and support people to maintain this diagnostic equipment is going to be very, very important in how our healthcare evolves going forward. We have seen the supply of so many of this equipment during this period of crisis, but where is the operational and support manpower to run it to fix it when it breaks down, as it will do, and to repair and replace parts when this happens. And these are equipments like the MRI machines, X-ray machines, CT scan machines, echocardiogram machines, and so on and so forth. Dental chairs, for example, and so on and so forth. In closing, I would like to say that for me, COVID-19 offers a huge opportunity to develop a broad-based maintenance economy that employs the largest capacity of our people in the built industry. It offers an opportunity to sharpen skill sets to the highest competitive levels. We can be as competitive globally as we choose to be. And we have seen that in an area where perhaps, again, we didn't set up properly the structure in how our young people have adapted to handheld devices like phones and tablets, and they've been able to fix them in their own innovative way. So these are capacities that suggest that our people are good with electronic and electrical devices, and that if we pay more attention to it, they can acquire the highest levels of skills and can compete at the highest possible levels. Of course, I know that there are offers funding by central bank, and I think with good advice, businesses that need to do so can engage and access those fundings where there's a clear plan. Lastly, I think that it is instructive now for us to have a better and clearly defined relationship with original equipment manufacturers. Those are the people who make our equipment, because many of them are made outside our jurisdiction, so we are end users, but to insist perhaps now that training, repair, and maintenance programs are inherently embedded as a matter of contract in those equipment when we buy them. A nation in Asia, India, has developed a large capacity of its human capital in this area of biomedical equipment maintenance, and I think we can compete if we try. I will stop there. Dr. Ayeye has been kind enough to send me a few issues around healthcare, but I think that it would be fair to stop here and come back as we go on to address some of those issues as a more interactive question and answer type thing rather than the monologue that we have had for the last few minutes. Thank you very much.
Thank you very much, Your Excellency, the Honorable Minister of Works and Housing. Always a pleasure to listen to you and to challenge you, knowing that you will take things forward. There are a few, Mr. Governor, we're coming back to you shortly, but I would just like to go to Professor Abayomi, who has become known for his uncanny ability to keep COVID out of Lagos.
The deputy incident.
And on our screen, coincidentally, is next to the chief incident commander himself. So we feel very safe that we overcome COVID very effortlessly. But taking a cue to some of the things that their excellencies have said, we want to just ask your thoughts on the infrastructure side and on the service side. The governor shared with us some of the things that the state has done and is doing and will continue to do. But marrying both, we see that there is the service side, the clinical side of the equation, and the building side of the equation. We had His Excellency the Minister of Works talk about the primary healthcare centers and water and waste, etc., etc. So the question, sir, our Honorable Commissioner, what would be your thoughts in terms of de-articulating those two sides of the healthcare service, i.e. infrastructure, healthcare infrastructure, equipment and asset management as a distinct maintenance economy, like the minister would say, and then the art and science of care and delivery of care itself. What are your thoughts about the possibility of that? Because I noticed Mr. Governor said one of the things we pushed at him, that he was not going to put his head, on that chopping block. How do we ensure that clinicians have all they need to provide clinical care and ensure that the people who are equipped to manage the building services and the assets and maintenance of those assets are equipped to do that in a manner that does not make your medical director become like a facility manager? You should be focusing on clinical outcomes and care of patients, because the management of his building service and assets and infrastructure are optimal. We'd like to take your thoughts on this, sir.
Thank you very much. Can you hear me?
Please continue.
Can you hear me?
We can hear you, but it's very low, and it still says that you're mute. Okay, now you're mute. Okay. Now
Can you hear me now?
Yes, we can hear you now.
Okay, thank you very much. Thank you for the preceding talks from the Honorable Minister and of course my Student Commander, Dr. Babajide Sanwo-Olu. Thank you to the organizers for this very interesting dialogue. So I think your question is very important. And let's start the dialogue by saying that maintenance starts at the design of the infrastructure, because the maintenance establishment would like to have a participation in how you design the infrastructure in the first place. Now, what Mr. Governor has done in Lagos State is he's approved a process whereby we're developing blueprints. And we're developing blueprints for medical facilities across both primary, secondary, tertiary, and centers of specific excellence. So most of our hospitals and medical facilities in Lagos and across the nation, for that matter, are not built fit for purpose. And we have great difficulty maintaining such infrastructure. We know that design, build, mechanical engineering of medical facilities is a subspecialty. We know our environment is a hot equatorial environment. And generally what has been happening is we've been building facilities that are best suited to the temperate or cold climates. We've stopped using natural designs of low energy footprint architecture, and therefore our maintenance bills have been extremely high. So we have buildings that are closed with poor ventilation, poor patient flow. We've not used the microenvironment to cool down the building. We find that we're spending a lot of energy on facility maintenance, on running of facilities. So with these blueprints, which have been commissioned by Mr. Governor, we are halfway through. We're going to develop these facilities in such a way that they are designed and built fit for function. They're cheaper to run. The energy footprint is lower. The maintenance facility managers have an input into the design because they know how they're going to repair these facilities. So when these blueprints are ready, and we're beginning to roll them out now, we will have a particular look, feel, and function of our medical facilities moving forward. Now, when it comes to actual maintenance, I totally agree with you that this must be removed from the complete responsibility of the oversight medical personnel in that facility. And what we have in Lagos is the Lagos Infrastructure Asset Management Agency, which was set up during BRF's time. It serves to ensure that medical assets and other assets within Lagos State have a maintenance framework, which at the moment we've not really fully adapted that phenomenon to the medical side. And some of the hospitals in the secondary healthcare platform and the primary healthcare platform carry out their own maintenance from their internally generated revenue or from some of the budgets that's allocated to them. And that takes away from their function as primarily as caregivers. So as LACIAMA becomes, have a heavier footprint, a more defined role, make a business out of maintaining the infrastructure by recruiting professionals that know the job and know how to ensure all the assets of maintenance, including minor infrastructural adjustments, then I think we'll be in a better position to divorce the role of clinical care from maintenance, which should have the oversight of the medical director or the medical officer of health, but it shouldn't consume his energy and it shouldn't consume his budget either. So I think we're moving in that direction. In the last 3 months, we've been talking about defining a clear maintenance framework for our secondary and our primary healthcare facilities. But I think the most important thing is what's happening now, which starts at the design level. Once we get our design right, fit for purpose, low energy, easy to maintain, then I think we'll be on a much stronger footprint moving forward. Thank you.
Commissioner, one of the things that I've also been very humbled to do is to be working closely with the Commissioner, regarding this COVID pandemic and also all other health issues. And one of the things I must say is that the interventions that have been put in place for Lagos, as I just said, are very pragmatic, and we look forward to a lot of those interventions. Thank you very much for your leadership in this COVID response also, and we're looking forward to a lot of the innovations that you have just mentioned because it's very important. One of the writing questions I might want to ask would be how to maintain the financing of all of those facilities when they're done. You have mentioned that, yes, the maintenance of those facilities should be taken away from the medical personnel. But again, there's also a need to sort of create a conduit to which how those facilities will maintain. Would it be still under the Ministry of Health? Will it be done through a demand side activity? It'll be interesting to know how the facility will be maintained. But just before I ask you, just want to find out, because we want to make sure that we get as much as we can from Mr. Governor. I'm not sure if he's still available right now. If he's not, I'll request that you answer that question, but if he is, then we can quickly go to him to answer the question that we have. Thank you very much, Mr. Governor, for being with us. So far, a lot of people did not think you would stay this long, but I told them that, that I know my governor and I know that he will be present throughout this conversation because health is a very germane topic for him. The pandemic could harm the structures of liberal democracy, and nationalism is likely to increase while globalization retreats. As the coronavirus exposes society's fragility and the interdependence of globalized industries, it might fundamentally change our worldviews. The power of the state and the public perception of its role will shift dramatically. The pandemic and the recession may be the sort of world-changing event that allows for new economic and intellectual beginnings. Internal, social, economical, and political turbulence will cause many countries to focus their attention inwards. New modes of collaboration between the public and the private sector will emerge for future surge capacity. As the chief commander of Lagos State, it implies that a lot of the people that would usually want to access healthcare outside of the country may not have that luxury anymore as countries begin to develop their own systems. What will be your plan, or how do you think we can improve the physical functionality of the already grossly underperforming healthcare facilities and assets in the country, especially also leveraging through health technology? So this question is not just limited to Lagos State, but it's a national problem because Lagos State might be doing something in terms of how they want to do that, but it's important that every other person that is listening from all over Nigeria and all over the world listens to your advice on how you think this can be done. Over to you, sir.
Thank you very much, Doc. And just to also correct, I will leave after this question because they've been waiting for me, so I will not wait till the end. But I really wanted to hear a few of the speakers also contribute. But thank you very much. I think the point to ask is this: what takes people out of your own territory to want to go and sort medical health somewhere else? Why will the Nigerian go to India, for example, or go to United States, or go to Saudi Arabia, for that matter, to seek health issues? I think one of the very first things we need to look at, around here is that we do not have data. We do not have data even as citizens. So we are not, updating ourselves to even know what exactly are we treating, in what form, and in what shape or form. So that's why I'm not even talking about medical research now. I'm just even talking about basic data, right? And like Dr. Yemi, Professor Yemi would know, they are in an environment where you can, every head, you can count for everybody. You can count, where people are, what they're doing, what line of businesses they have. And that begins to help you, put proper demography in perspective, right? But to speak to why or what are the things we can do to be able to slow down that movement. It's always been said, and I'm sure Dr. Aye also knows, a whole lot of your colleagues are out of the country, practicing medicine in other parts of the world. It's been said that there's several fine, distinguished Nigerians that are doing first-class, jobs in other parts of the world. So what are the things that are lacking, right? Infrastructure it's one of the major components, right? So we have seen institutions develop people, develop doctors, develop different health practitioners that have shown that it's not where or what you've learned, is really how you've been able to practice what you've learned that is important and at what price, right? So infrastructure is still what is not available around there. And infrastructure starts from as little as power infrastructure, right? We built a facility, thank goodness, Governor, Minister Fashola knows, the renal center in Bagada, which uses about 1.3 megahertz of power. It was fine electricity. It was a kind of place where you need to be able to refine and know what goes into every of the socket that is there. We do not have such capabilities, either from the biomedical side or even people that are meant to be keeping such infrastructure. So infrastructure is not just to have a building. Infrastructure goes beyond just having a building. Infrastructure as in, what kind of input are you putting when you're developing that infrastructure? What kind of after sales or after commissioning capability do you have? How well are your, lab, your technicians, your plumbers, your electricians, how well can they maintain and sustain that infrastructure, right? Moving away from infrastructure, I've talked about human capital. I'm not sure our problem is human capital because we also can bring them in, but it is also proper funding and being able to remunerate all of these very important skills to be able to remunerate them properly, right? So if you also can attract some kind of remuneration that can keep them, know that it's not because of the next $1,000 or $2,000 that people are leaving the shores of our country. Let's also be able to do that. More importantly, is also to ask ourselves, what really can government swallow? What can government do, in itself? Government needs to be sincere and be real, to himself. And that will go to your view around, health insurance scheme, and how we need to have proper capitations, and how we need to have who can do what, right? So one of the things that we see is we have one tertiary health facility. How well can we build, medical health parks? How well can government enable investments to come, to that sector very quickly? We have 2 or 3 that we have sent out expression of interest in, and we're hoping that we can get local and international investors that can come and do, that investment. You know, and I think that the very last one is, where are the equipments coming from? India has been able to use their skills of technology to be able to develop a lot of these medical equipments, right? You need original equipment manufacturers who need to also believe in your system. They need to be able to know and stay with you the long haul. When you bring an MRI machine, and it's a couple of $millions, and they expect you to pay cash, you know, for that, it would certainly it will not activate investment. It has to be seen that these are investments that will take a fairly longer tenure for you to recoup them. So it's a whole combination of conversations that needs to happen, right? From the core medical side, they need to really know and slow down and know that, well, they're committed to this country. We want to wait, but we want to see infrastructure go up. Government also must be able to clearly be able to develop first-class infrastructure that is accessible and is also affordable. Affordability becomes an issue because, you know, you look at our level of poverty, you know, how many people are below the poverty line, and what are the places where government can continue to make, you know, budgetary investment. I have given a commitment to say that year on year, we will continue to increase our allocation, you know, in that space, in the health facility. We will continue to encourage, you know, our health professionals also to scale up even their own training, you know, and their own capacity to be able to look at new ways of doing clinical trials and clinical and clinical diagnostics, so that they are in tune with realities of the world. You know, how can we do it cheaper and quicker, right? India has been a place where if you go there, they do some of this high care at a rate that is far cheaper than America. The question we'll ask ourselves, why have they been able to, you know, do that and with those kind of, numbers that were. So it's a conversation that cannot end here. It's a conversation that all of us need to sit back and see who's playing what role and how can we bring all of these things together. And that's why I said that the three topics we've talked about, you know, facility, technology, financing, you know, has to be a conversation we take beyond, you know, just this very simple webinar we're having today.
Thank you very much, Honor, for that. And we are happy that you have stayed with us so long. If you have to leave, we appreciate the time that you have spent. We know that you have other pressing issues, and I'm sure that the whole of Lagos State and indeed the whole of Nigeria appreciates you. Once again, thank you for your leadership, for your pragmatism, for your humble nature, and for your go-getter attitude. It's great, and I tell you that it is encouraging a lot of us of the younger generation to take the same steps that you're making, so that we can also do the impact that we can in our own little way. Thank you very much, Mr. Governor.
Thank you very much.
I'm going to go on to ask Tony Adeniji to weigh in. Tony is the Executive Director of the Bank of Industry. And for as long as, I think the first time I met Tony was a decade and some change ago, she's always been working in the space of poverty alleviation and mobilizing financing for MSMEs. And currently in our role as Executive Director at the Bank of Industry, is in charge of providing loans, providing access to finance for micro, small, and medium enterprises. Now, Tony, I don't know, let's take your thoughts on some of the issues that have been raised today, but I'll hone down specifically on health insurance. We heard Mr. Governor of Lagos State talk a lot about health insurance. We had the Honorable Commissioner talk about it as one of the veritable tools. Now, but this is where I'm going. Mr. Governor said he's not going to take a radical step, but step-by-step building on the plans and programs that they have. Now, within your space, what can you do to ensure that all the people that you serve, all the people that you empower, all the people that you provide access to finance, that embedded as part of providing finance to them is ensuring access to healthcare? is ensuring that they have a functional health insurance, because that helps even to de-risk some of your own loans and supports the effort in your own way of what the governor, the commissioner, and I'm sure the minister at the federal level doing to increase or to accelerate our journey towards universal health coverage. Let's take your thoughts on it, on this thing. Okay, here we go again.
Yeah, we can.
Okay.
Okay.
I think I can take care of that. First of all, I'd like to thank you very much for inviting me to this webinar. It's a very exciting topic, and the discussion has been very, very interesting thus far. I'd also like to say thank you. I feel very honored to be part of a very distinguished panel, to the excellencies, both excellencies, Executive Governor of Lagos State and the Honorable Minister for Works and Housing, and all the other panelists that have spoken and will speak after me. So thank you very much. It's a very interesting topic, and focusing on health, health, the facilities, the technology, and also the financing. So I come in from the financing side, but I think the excellencies and the Honorable Commissioner, they've done a great job in touching on quite a few things that would sort of weave in financing. So they've talked about the fact that government has its role to play at the national level, at the state level, and in terms of infrastructure, in terms of the actual facilities. And the governor spoke a lot about the insurance scheme for Lagos State, and I'll talk about that later on. From the Bank of Industry perspective, certainly we believe in the sort of public-private partnership model, and that's very clear as something that has to be done. So there's of course the demand side, the supply side. So on the demand side is how do you stimulate such that there's universal coverage, and the people can actually afford or access health services, and I'll speak to that in a minute. On the supply side, of course, is how do you actually look at that value chain, and how do we jump in with financing so that we can improve or make it more seamless or make it easier. And that's also something that the Bank of Industry has been very involved in. So on both sides, we are involved more on the supply side, but certainly, again, when you're drilling just on, focusing on the micro, small, and medium, then you now have to start thinking, in some ways, how do you protect your, the loans that you give to the MSMEs. So the Bank of Industry is involved along the value chain. On the supply side, we have taken this COVID situation quite seriously. As soon as the pandemic was declared, we had to go to the drawing table and really say, what do we do? And the health sector, or our health portfolio, was one that we had to pay very close attention to. So in addition to the palliatives that the central bank or the federal government announced through the central bank, we also went to the table and began to look at our portfolio to see how we could support that portfolio even the more, in terms of making access seamless, in terms of making access also provision of services and accessories in the pharmaceutical sector as well. How do we encourage them, help them to do more in that space? So we've been very, very active on the supply side, and we continue to do that. But to go to the question you asked specifically on insurance, how do I see, or what are our thoughts, or my thoughts on universal health insurance? Yes, when we deal with the micro and small enterprises, a lot of times you are focusing on one-man businesses or small businesses that might not be able to, typically would be left out of or excluded out of a health system that does not, cater for all, that's not universal. So what do you do? Health insurance is good. but that is something that while private sector can participate, it's something that's at the policy level, it's at the purview of the state or at national level to provide or have a scheme, like Mr. Governor said, for Lagos State, where they're trying to drive uptake. It's very, very critical that the excluded, which in most cases would be a lot of people that own, if you're looking at the bottom of the pyramid, you're looking at poor people, vulnerable people, women that might not ordinarily afford health services, children. It's very important that the government, through policy, is able to provide access to these people. One of the best ways to do that is through access to primary health care. So what does that take? A scheme that would allow them to at least be able to treat certain things. The governor talked about birth, talked about sort of very primary or basic health care. And so this is very key. Now, in terms of our own, as a development financial institution, what can we do to drive or to make demand, or to drive demand and make it affordable, make it accessible, and also the availability? On our own side, there are two things. It's either there's health insurance and there's life policy, life insurance. Now, health is what is needed because health is the quick fix. Health is what you need all the time. And that's something that would be good, but what can we do as a financial institution? At the micro level, there have been some uptake on that. I must say, as a financial institution, it's very difficult to layer that on top of one of the, yet another criteria for for loans or microcredit to be given out, or even small loans to an SME that's dealing with so many other issues. Can we force it upon them? Can we make it a compulsory thing? We have not done that for many reasons. Again, they're dealing with so many other infrastructural issues, so many ecosystem challenges. And so enforcing or saying, you must go and take some health insurance, which might be at an additional cost, is a burden that, we'll be very careful to layer on an enterprise. But when we work in partnership with the state, or when we work in partnership under a PPP, then that accessibility, that access will be there. And then it's something that they can afford. It's something that they're now included. And so therefore, it's even easier for them to access the kind of funding that we would give. The same thing goes for micro enterprises or even smaller businesses as well. Adding another layer of health insurance as a cost that will be borne by them could be quite tough. What is popular in other markets that we have seen, and I think it's slowly beginning to uptake with certain insurance companies that we have been talking with, is the idea of cluster insurance, whereby a health insurance is provided on a cluster basis, so that by the time it gets to the individual or to the small enterprise or to the small business, it is now affordable. It's in a size that is affordable, and uptake is possible. So with partnerships like that, where each stakeholder takes its own space. So the government provides the policy, they provide the product. The private sector comes in to support that or to align with that. It's now possible to de-risk our own intervention. So I guess what I'm trying to say is, yes, it's an ideal situation. It will take public and private sector partnerships to make that happen, to make it seamless. Yes, it would be ideal for micro enterprises or the small businesses to be able to afford or to have some health cover, because in some ways that's a risk mitigation. And so we would play our role, but it's a coming together of stakeholders to move that conversation forward. It's coming together of stakeholders to ensure that both sides are balanced, both on the demand and the supply side. And it's coming together to make sure that these things are enforced. The governors or the excellencies also talked about technology. Technology is also very key in driving this kind of uptake. In the work that I have done, in recent work and that Bank of Industry has been very involved in, is the execution of empowerment programs, microcredit at the very, very basic level, to micro entrepreneurs, to small business in the marketplace, to artisans, to young people. And we have used technology to drive that. So technology is key in actually reaching or including MSMEs even in the health space. It's a totally different space. I'm not a technology guru, but I know from the work we have done, in actually giving access at that level and at the kind of numbers reached. I mean, we've reached more than 2.5 million people in terms of credit. On our database, we have more than 5 million people all across the 774 LGAs in Nigeria. And so we have the infrastructure to reach these people. We have them on our database as uniquely identified people. So therefore, the same technology, or a variation of it, can also be used to address a system whereby these same beneficiaries or this same population have access to some medical policy or medical insurance given by the state, given by, at state level, at national level, and therefore you can layer the health services on top of that. We talk about telemedicine and all sorts of things like that. That's good. But again, other things have to be working as well. Telemarketing is good. Will 80% of Nigerians be able to really make use of it? Yes and no. Of course, with smartphones, a lot of things can be made possible. But one of the things that we also know from experience on the microcredit side is that when you're trying to be inclusive, you have to be very careful of how the technology meets the users. So while the back-end operation must be as technical as possible, because that's how you can scale, the actual journey that the customer enjoys, or the actual interface, has to be simple so that they can enjoy it. So WhatsApp is very, very, very popular. And so those are the kind of technologies that we can begin to really we can begin to scale immediately in many ways, for information, for basic treatment, to know where to go when there's an issue, to know how to even manage your health insurance policy. So a combination of all of these things is very important. PPP is very important, and making sure that the whole value chain by itself, if I can call it that, is seamless is also very important.
Thank you very much, Mrs. Adeliji, for that very esoteric conversation around what the Bank of Industry is doing. I can personally testify to that. The Bank of Industry is in partnership with PharmAccess to see how we can revitalize primary healthcare centers in several states. We've done that in Delta State, and I can say here also, I'm hoping Mr. Governor can still hear us, that the Bank of Industry has some funds up to ₦1 billion available to partner with Lagos State to see what they can do to improve the healthcare facilities. I will quickly go to the next speaker on the panel, Mrs. Njide Ndili, who is my boss. She's the country director of the PharmAccess Foundation, but she also sits as the Commissioner for Artificial Intelligence and Digital Intelligence at the Lancet Commission. And so I would like to ask you, we're beginning to see the impact of COVID-19 on healthcare facilities, health-seeking behavior, and ultimately health outcomes. For example, estimates based on research from the Johns Hopkins Bloomberg School of Public Health warn that the disruptions in the medical value chain could result in potentially devastating increases in maternal and child deaths. Budgetary constraints due to drop on government revenues will likely impinge on the already inadequate per capita health spend in Nigeria already, and the list of challenges go on. Is there a role for digital and artificial intelligence to mitigate these issues? Can we leverage on technology to alleviate our expected and already high health indices? Teleconsults have become very popular, and but the question is, how are we going to extend this to the classes and to the lower classes and to the rural areas? How do we deploy this to underserved population considering power, cost of data, and smartphones. Over to you, Mrs. Ndidi.
Yes, so thank you very much for organizing this session. I must say thank you to Mr. Governor, to the Minister, to the Commissioner who worked very close with, and the rest of the panelists. I think the discussions so far have been, as usual, focused on the supply side. But before I go into your question, I think it's very important that we begin to focus on the demand side. With COVID now, we've seen that, we're pretty much on a level playing field because all of us are stuck within this country and we couldn't even leave if we wanted to. So the basic question, we have to ask ourselves is, why is our healthcare system not working? There are some fundamental issues in the ecosystem, and I have a slide which, I want us to keep that at the back of our minds as we, have these discussions, or even go further when we get back to our various facilities and our jobs, to think about what interventions we can do to mitigate some of these issues. Because fundamentally, a lot of funding is spent on upgrading facilities, but yet, where is the trust in the system? People would only uptake health insurance if they trust, or first of all, prepay for it, and trust that when they go into the facility that they're going to get, good treatment, the services will be there, and so on and so forth. So I think that is the starting point where we need to focus on. How do we, get the demand side working? How do we, make sure that the people that need the healthcare services are getting it? And we have to start this by fragmenting and segmenting the population, and then focus, aggressive targeting, communication, behavioral change, and communication to the different segments of the population, starting at the top of the pyramid all the way to the bottom of the pyramid. I think that is very key. And that is where technology comes in. Because all of a sudden with technology, you can begin to unite fragmented funding. Right now, there's out-of-pocket payment. We have all sorts of vertical donors, vertical programs focused on disease-specific programs. We have philanthropists who are contributing funding, paying for their family members, and so on and so forth. There's health insurance for those at the top of the pyramid. But again, experience has shown us that if insurance is voluntary and fragmented, it's not sustainable. So we have to work towards finding a way to unify the funding, the fragmented funding, and this you can do through technology. I can tell you that if you have a platform which aggregates the funding, regardless of the source of the funding, be it government, donors, savings, individuals, then it's easier to pool the funding. After all, health insurance is about risk pooling, where the sick are catered to by the healthy, the rich catered to by the poor, and so on and so forth. So that is so fundamental, and it is technology that can help drive that. And we're seeing some of this technology come into play. There are quite a few examples, and coincidentally, Lagos State is actually using one of those technologies, which is CarePay, which is a wallet on the phone that can store your insurance, and also other benefits on the phone that can pay for services at the time that is needed. And what this does is it moves the power to the patient, because all of a sudden they have control of where they go, how, who gives them services, they authorize the services, and so on and so forth. So that's the first thing, aggregating and unifying fragmented funding. Then there's also the local resource mobilization. Now, we have government that is, in all the laws that have been passed, just to say that so far, I think about 33 states out of 36 and the Federal Capital Territory in Nigeria have passed mandatory health insurance laws. But passing the law doesn't translate to people accessing care through insurance. There's also the process of implementation. And that is where the crux of the matter is. How do we ensure that we are able to mobilize local funding in a transparent manner so that people can see the fund flows and where again, this can be done through technology. Right now, we don't have data like Mr. Governor said. And why don't we have data? We don't have the technology to track where the money is going, who is paying for what, how much. And without the money, you can't even do the proper actuarial analysis to determine what is the appropriate pricing for healthcare services. So that way you can plan and so on and so forth. There's also the issue of smart contracting, or maybe even you can call it output-based financing, where you're able to pay providers based on services or quality of the service that they've provided. This again can be tracked through digital health and artificial intelligence. Then my predecessor, Tony, from Bank of Industry talked about financing. Again, this is what is lacking in the private healthcare sector, where hospitals, SMEs, as we know them, that are providing the services are not able to access financing. Historically, they've been mom and pop small hospitals. And for that reason, they may not have the governance structure, the financial management systems, and so on and so forth, to be able to go to the bank and request a loan to expand their scope, improve the quality of services that they provide. Now, we are at PharmAccess, we are starting to partner with 1 or 2 banks to begin to test digital loans. If you think about it, if a healthcare facility is able to install health management systems, we are able to see the daily financial flows, and that way we're able to extend much needed working capital or loans to the healthcare provider at really reduced rates. So these are some of the areas. Then we've heard a lot about artificial intelligence and the ability for machine learning and task shifting, telemedicine, and so on and so forth. This is really key. In fact, the fact now that we're even having this webinar, and I can tell you at the last count, there were over 600 people in attendance. We've never, in the history of organizing conferences, had that many people, but this is the power of technology. We're able to educate, we're able to train, we're able to provide information to people without actually being there. So again, there is a role that technology has to play. In fact, also with COVID now, we are sometime next week going to roll out a mobile phone app that helps track symptoms of COVID patients. It's called Lucy. We are deploying this at FMC Ebutemeta. Again, we know that the numbers, even though it's not as astronomical as in the rest of the world, but we are actually seeing daily increases, much more than we expected. Every night I wake up about 12 midnight, and I don't know why they send those numbers in the middle of the night, which deprives you of sleep. And I think today was the highest we've seen so far in Lagos. So it's evident that we need to find a way to, first of all, track the movement of the disease. I couldn't tell you what area. Is it in VGC? Is it in Ikoyi? Is it in Agege? Where is the cluster of COVID patients, so that we're better able to even manage our own movement? So what this app will do is that for those people who are starting to be symptomatic, but are able to stay at home, they can log their symptoms, and we can, on a daily basis, and as it progresses to the point that it triggers a reaction from the healthcare center to either evacuate or provide additional services, either at home or evacuate to the hospital. So when you talk about technology, I dare to say that this is the only way going forward that we're going to be able to fill the gap in our healthcare delivery system, especially with the limited human resource for health that we have in Nigeria, with all the doctors leaving Nigeria. So, technology has a very critical role to play, and mining of that data and analyzing the data is very key also to policymakers to be able to know where to deploy the resources, which are very limited at this time. So I think I'll stop at that and look out for other questions. Can you hear me? Am I on mute? Hello. Okay.
We're waiting for the moderators. Dr. Njide, the reason we put out those figures at midnight is, is because that's when we finish cleaning up the data. And because the testing has been running throughout the day, we have to match the sample with the patient data, make sure we don't have duplication. And when we've cleaned the data, we separate the new cases from the repeat cases. And then we know our new positives for the day. And then we push that out, usually between 11 and midnight. Sorry for disturbing your sleep pattern.
It gives me nightmares, but it would be nice to also have, you know, kind of a breakdown of the clusters and the patterns of infection, because it will help some of us who have underlying medical conditions to know the next step and, you know, what to do, because you know, you have no understanding of where the numbers are or where the infection, how it's progressing. So this is something that digital technology can actually track, because it can read your location, it can read your symptoms, and that way you are better able to manage the growth of the cases and know how best to either redirect or deploy you know, the individuals for medical care.
If I may, I think I want to weigh in on some of the points that you made, if you can hear me.
Yes, we can hear you, sir.
Yes, we can.
Yeah, and I think that the way we have discussed healthcare and approached it, especially in public conversations, should change. I hold the view very strongly that we have focused too much about building hospitals, providing health facilities, when I think the idea is that really and truly we were not meant to be in hospitals. And it is the preventive side first that should engage our attention. I say this in the context of, at this moment, the Vice President is inaugurating a washing and sanitation and water supply steering committee about building toilets, cleaning Nigeria, because the way we have managed our human and public waste has impacted significantly on the common ailments that we have seen, the choleras, the Lassa fevers, and so on and so forth. So I think there should be much more investment in water supply, waste management, and nutrition. And therefore, for me, it's a battle between wellness and illness. And we can win the battle against illness first by making sure that this human machine rarely or never gets sick. So I ask myself, where would there be enough mechanic garages for all the cars in Nigeria where they all break down? So I think that's the first thing I would like us to perhaps reappraise. The conversations we should have, an investment in water supply, sanitation, health management, and nutrition. Then going from there, as I said, to the primary healthcare centers, which is where everybody should be. There's a model that was started in Lagos State trying to ensure that there was one functional primary healthcare center in every of the 7 local governments, working on a 24-hour basis. I think about 11 or 12 of them started running, and I believe that the government is now committed to ensuring that this is delivered. Again, in terms of insurance, I hear all of the ideas that have been put out there, but let me say again that I was involved in this when I was governor, and some of the things we tried to do was to say, okay, most of the healthcare facilities in private sector, what is the occupancy? How busy are they? And we saw many idle assets. We registered and enumerated and registered some health practitioners in the process of trying to operationalize the health insurance scheme. But my thoughts are that the common diseases are typhoid, malaria, cholera, and the challenges of funding childbirth, especially for the people at the lower end of the pyramid, and of course, immunization of children. If we could, as it were, define how much it costs in the average to treat a case of malaria, because the people who don't have insurance actually pay one way or the other. And if we then sell this to them, and I like the idea of cluster insurance, but beyond that, let us understand that the people at the bottom of the pyramid pay, they contribute, and they save money in their informal associations. For those who are Yoruba speaking, they have what you call a job. And these are a form of insurance against. So in designing the insurance models, I think we should bring them down to street level and explain to them that if you invest so much as a saving, if you fall ill, you can choose any of these 10 hospitals and they will treat you for malaria. If you have special conditions, then we can begin to change the pricing. And when we did the indexing of these numbers at the time with the health team in cabinet then, we looked at an average cost of, say, 2,500 naira. How many people could afford to pay that a year? 2,500 naira a year. And we looked at our insurable population, which were people of childbearing age of 18 and above. There were about 9 million people in that bracket. And we were looking at a fund of about 22.5 billion naira. And those were some of the places where we stopped. But let me close also on the issue about two issues, clinician and facility management. And I agree, I couldn't agree more with the views expressed by Dr. Yeye and Professor Abayomi. I think the time has come to separate hospital management from hospital care. And the clinicians who want to do hospital management must sign up, get certified, and leave clinical work. And really and truly, if you ask me, you don't need a medical doctor to run a hospital. You need a logistician who has knowledge of the business, who can ensure that your theater is ready, your equipment is working, is functional, there's an inventory to replace equipment that is not functioning, there's a timeline to repair. And this separation must happen yesterday, not even today. And it's a hard decision, and in the public sector, I hope that the government will have the courage to do this very, very quickly so that professionals can focus on their core responsibility, which is administering clinical services and delivering care. The other point I want to make in closing is about telemedicine and all of that. And to say, first of all, that let us go back to the basic meaning of the word tele. It just means at a distance, something happening remotely. So it can be telephone, which is just distant talk, and it can be television, which is distance visual and all of that. And so in their crudest forms, they will work. In their more sophisticated forms, of course, we need to do a lot more work. Roll out more broadband. We have about 80,000 kilometers of broadband to roll out to cover all the federal road network, but that is nothing compared to what the states have to do and the local governments. And so, but I like us to stop bemoaning what we don't have and acknowledging where we are and deciding that this is where we want to be next. So when I hear generalizations like, oh, our healthcare system is not working, it is unkind to those who run that healthcare system. Because yes, we want them to do better, but it is inappropriate to describe them as not working. People deliver babies there, people get treated there, there are capacity issues, certainly, but we can benchmark today's successes as inspiration steps of ladder for them to improve on what they have. And given my knowledge about healthcare system, I don't know many countries who have all the capacities that they want. So people travel from the best countries to other parts of the world to go and specialize care as well. So my sense is that the way we describe our problems can be either inspirational and defeatist. I tell people that, look, yes, we have infant and maternal mortality, but not everybody dies in the hospital. So let us focus on what we did to deliver mother and baby safely and do more of that. And let us make sure that we do less of what happened when we lost a case. That is how people repair and improve. And these are the negativity about our challenges are not unique to us. And while other jurisdictions are promoting their strengths, we should stop promoting our weaknesses. We should see them as challenges about the work that lies ahead. I'm doing this because I will soon have to leave you to another meeting, and I thought that I should perhaps sign off appropriately. Thank you for permitting me.
Thank you very much, Your Excellency, the Honorable Mr. Babatunde Raji Fashola. You know, we are very, very grateful for your presence here. We had told the Minister, the Honorable Minister, that this would be ending by 12:30, but he has graciously stayed up until now, 12:45. And so we just want to say thank you to you, and also thank you to all our panelists for keeping on. And we can still see that Mr. Governor, His Excellency, the Governor of Lagos State, is still on. I'm sure he's listening, but he's also in another meeting. We also want to thank him for staying on and keeping logged on. It just shows how important health is to all of the people that are here today, and the whole of Nigeria appreciates you. As we go to the final statements, we're about rounding up. We would like to start with the Honorable Commissioner for Health, Professor Akin Abayomi. First of all, to answer the initial question I threw at him at that time, and also his leaving comments for all Lagosians and indeed the whole of Nigeria on surviving the times, the future of healthcare in Nigeria. Professor Abayomi.
Just remind me the question you threw at me.
So the question basically was, yes, we have agreed that, or we have said or proposed that facility management should be separate from hospital services, and and the question was, who then handles it going forward? Is this still going to be coming out from the Ministry of Health under the auspices of somebody else, or is it going to go to another ministry? How is that financed? Is it coming from finances from the Ministry of Health, or is it going to be another budget that will be created by government to ease out on the budgetary requirements from the Ministry of Health? What are your thoughts around this in how that separation will be able to be implemented?
Well, I think it's not so much around where the budget comes in, but more around where the framework of implementation is and the buy-in of the various sectors of public health service. So some of that budget is domiciled in the Ministry of Health, and some of it is in the Ministry of Works, specifically in the Asset Management Agency. But the whole spectrum of maintenance, as I said, starts from the design, build, implement, commission, and then maintain. So in the absence of a good design, build, and maintenance framework, we're going to keep having this situation where we have poor design and poor ability to maintain and expensive buildings. So we are in the process of changing all that. The infrastructure blueprints are in development. We're working very closely with Ministry of Works through the Asset Management Agency to define that framework that runs through the secondary and the primary healthcare facilities, and of course the tertiary facilities, to get a very clear understanding of who is responsible for what, who pays for what, and where the human resources that are going to deliver those services at the 2 or 3 levels of our healthcare. I totally agree that, health facility management is a discipline on its own. It shouldn't interfere with clinical practice. We have such a shortage of doctors in Nigeria and in Lagos as a whole. We shouldn't be consuming, somebody who has spent 10 years specializing in a discipline, spending half their time in administration and facility management. So, these are some of the things that we're going to roll out in the next few months to define that new perspective in ensuring that we have an environment that's conducive to good patient care, a professional environment that our healthcare professionals enjoy working in, and of course, for the patients who are going to be our clients. So my parting comment to people listening, we in Lagos have prepared very carefully for this scenario that we're seeing called COVID-19. This has helped us to dampen its impact on the society. We learned many lessons from Ebola, and certainly we're learning many more lessons from COVID-19. This is not going to be the first or the last. We are expecting many more outbreaks of this nature moving into the future. I think what the Honorable Minister was talking about in terms of the health of the environment is something that we've imbibed very strongly in Lagos, and we call it the One Health paradigm, which is a combination of environmental health, agricultural health, and human health. And the One Health paradigm goes far into the concept of ensuring that your environment is healthy, because you are only as healthy as your environment. You're only as healthy as the food you eat. So if you look after your environment and your agricultural base, then you will have healthy citizens, and you're going to be preventing disease rather than always trying to cure disease. So while we're doing that, and then we put a lot of emphasis on our primary healthcare structure, into surveillance, into primary healthcare implementation, vaccines, good nutrition, because we're talking about human capital here, and human capital is a combination of health and education. A young child in the fetus, in the womb, the fetus, his neurological development is dependent on a balanced diet that the mother gets. The first 4 to 5 years of a child is important. If we're going to develop the next generation, we need healthy minds and good education, and then we have what we call a solid human capital base from which we can grow our economy. So COVID, we're ready for COVID. We're dealing with COVID. It's given us some shocks, but we're learning as we go along. We're adapting. Every day we're changing our strategies based on what we're seeing, based on our data, and we're certainly learning a lot from this outbreak so that we can strengthen our healthcare infrastructure, our systems, and our human resources for health. Thank you very much.
Thank you very much, Honorable Commissioner for Health. From the comments and the chat that we're seeing, unfortunately, we will not be able to take any of those questions from them because of the time, but a lot of people are appreciating your work and the work of the incident commander in managing the COVID response and also in providing availability of healthcare services. I will want to quickly move to Mrs. Adeniji now on your final and closing remarks. Just about 2 minutes. We have 7 minutes to close out. We are very appreciative of what the Bank of Industry is doing. What would be your closing remarks for surviving the times of future of healthcare in Nigeria? Over to you. You need to unmute your mic.
Thank you very much. Well, in closing, I'd just like to state again that the Bank of Industry is very active in the health sector. We are funding MSMEs in different depending on if they're coming in from the demand side or the supply side. So that's something we're doing to survive these times or these times that we're in now. Accessibility is key, availability is key, and also affordability is key. So this is something that we bear in mind at the Bank of Industry when we're dealing with this sector. In addition to providing finance, the Bank of Industry also plays a catalytic role, and therefore we're able to convene and attract other financial institutions, other services that are non-financial in the work that we do. So we can give products or services that are beyond funding, which MSMEs need to thrive. In any case, we also play the role of advocacy. The Bank of Industry, being a developing financial institution, is not just focused on profitability. So we are able to play an advocacy role in pulling the different stakeholders together. So in the case of the health sector and the pharmaceutical sector, where we look at things from a value chain perspective, we are a convener of that, of the stakeholders and of that value chain. So, well, we're there to support. We're very, very, we're doing everything we can in terms of rapid response at this time to look at the health sector, to look at other sectors that are affected. And so we, again, I hope that, if there's need for us to be more present at the table, we are very willing at the state level, at the national level, to do what we can to make it seamless. Thank you very much.
Thank you very much, Tony, for your final comments. I will just take a minute from Njide, but just before that, Tony, I can promise you that your offer is already taken up, especially I know that Dr. Zamba, that the governor mentioned in his remarks, I'm sure will probably be knocking on your door before we can practically end this meeting. First, just before I go to Njide, to say that we have over 150 questions that have come in, and we have to end this meeting now. What we promise is to ensure that after now we engage with the panelists, the ones that we think refer to you, we'll push them out to you and we'll get it back to them. One that I noticed was that the Brazilian Consulate General sent in a question, and I'll be very happy to for us to put him and the Honorable Commissioner in touch, because we know what's happening in Brazil with respect to COVID. I'm sure there will be a lot of learning experience from him. We have people from the diaspora. Professor Emi is here from Canada, Dr. John from the UK, Dr. Adesire from the US, Dr. Famiron from Dubai. We have people all over the world, and we have over 150 questions, all our local people, all the people here. Claire, I can see there are tons of questions. And so please, all your questions will be answered after now. We will go through them, we'll engage with the panelists and get their responses back to you. And I'm sure the conversation will go on from there. This is not something we can do in 2 hours. We cannot fix the future of healthcare in 2 hours, but what the things that were said are great foundation. So, Njide, if you just have a minute to give your final comments on surviving the times.
Yeah, you took away 1 minute from me.
Yeah. Okay, so Njide, I add that minute back, so you get 2 minutes.
Understand.
So thank you so much for the excellent moderation and for the people who joined online. I think that this discussion is very critical and we shouldn't let it die here. The healthcare system as we know it in Nigeria has to change, and it has to be a system thinking approach, and it has to be multi-sectorial. There's need for government to increase its allocation in the healthcare sector. There's need for private sector involvement, even in running some of these PHCs, because we know that if government were to run it themselves, they will have to infuse more funding, which I'm not sure that they have at this time. So can private sector intervene and help support that process? How do we get health insurance with aggressive marketing to everybody that is living within Lagos State, for example? Because whether you like it or not, that contribution could actually help alleviate the cost of treating these COVID patients. Have we thought about including this kind of treatment within the benefit package? Are we getting information out to the people that, if you do fall ill, then, you can have health insurance and receive treatment? How are we training? How are we using technology to train, build capacity? But then most importantly, policy changes. When we talk about policy, what can we do to help the healthcare sector? With these difficult times that we're facing now with COVID, with limited income, is it possible for, to have some kind of, tax relief, tax holidays, waivers of duty? We've been able to achieve that through Healthcare Federation for medical equipment, and so on and so forth. So it's really, really important that we all come together. Everybody has a role to play, and you just need to play yours. For us as PharmAccess, we support along the healthcare continuum. So we work with government, we work with private sector, we work with providers, we work with academia, and so on and so forth. So let's all come to the table and, you know, put in our effort to make sure that the healthcare system works, because we're going to be in this situation for at least the next 2 years, because, you know, all the systems, healthcare systems in the world are really stretched and devastated. So let's do our part. Again, thank you so much for joining us, and we look forward to you joining in future conferences. Thank you.
All right, and on that note, from the PharmAccess Foundation and its International Facility Services Group, we'd like to say a big thank you to His Excellency, the Executive Governor of Lagos State, Mr. Babajide Sanwo-Olu, the Governor Emeritus of Lagos, Triple Minister, the current Minister of Power and Works and Housing, Mr. Babatunde Raji Fashola, SAN, the Honorable Commissioner of Health, Professor Abayomi. We thank you all. To Mrs. Toya Adeniji, Bank of Industry, to Indili from PharmAccess Foundation, Professor Yemila Ajudikon, thank you for joining us all the way from Canada, and to the over 650 people who logged in at one point or the other. We thank you very much, and we want to say to you that with this type of engagements and conversations, and with this kind of commitment, the future can only be better. We may be facing those challenges, but as Nigerians, the resilience of the average Nigerian will carry us through these times, and this becomes a foundation for a better future. Looking forward, we are looking forward, and we hope you're also looking forward to our next in the series of this conversation. Thank you, and have a great afternoon.
Thank you, everyone. Thank you so much, and see you soon.
Thank you.